when we talk about health pot, yes, we are basically looking at early childhood development, maternal and child health, and other public health areas. Edrine Osteen Mukalazi is my name. Allow me welcome you to today's show. This is Health Pot, and we are glad that your eyes are on Church of Uganda Family TV. Yes, here we are to continue with our discussion on family planning, and we are with Dr. Rashidah Nakanwagi, as we have been with her from where we started from up to today. And Meba Murungi, our sign language interpreter, already on the set, as you can see her. And here we are to take you through now another sensitive aspect of family planning. Of course, we looked at the myths and misconceptions of family planning as a general. But very many people, very many women have tried the various family planning methods, and they have come up with different myths on particular methods. When you use IDUs, there is this and this which will happen to you. When you use pills, this and this will happen to you. So Dr. Rashidah is here to demystify that what you have, or the misconceptions that you have on these various family planning methods. And we are looking at them individually. Doctor,
yes,
we are excited that we have you even today on Health Pot.
Thank you.
Yes.
Thank you so much.
Yeah.
And I'm glad to be here to give you more information about the myths and misconceptions of family planning. Yes, like you said, I'm from Maristops, Uganda, with the help of School of Public Health, Child and Maternal Health. That's why I'm here to give you this information.
Wow. So in one of the episodes that we've had on, I think that was the very first episode when you took us through the various types of the family planning methods. And I remember you told us about the natural family planning methods. You talked about the temporary and the permanent. And you said under the temporary there is the short term and the long term.
Yes.
And then we have the permanent methods. So all these methods, I don't know whether natural methods have a lot of issues. Yeah, but they also have.
They also have some issues.
They also have issues. I think we shall start with the natural methods. Let's start with the natural methods. Yeah. What are some of these natural methods?
Oh, okay. Because here we are talking about the myths and the misconceptions.
Yes.
So we want to break them down per method to make sure people understand the common question that people ask about the different methods. Like it took me to the natural methods. Some people believe that when they are breastfeeding, a mother believes that when she's breastfeeding, she cannot get pregnant.
Exactly.
But let me tell you, when you're breastfeeding for the first 0 to 6 months, exclusively breastfeeding, you're safe. But if you start introducing other forms of...
100% safe?
No, you're not 100% safe. I'm coming. So I'm coming to explain that.
Okay.
Some mothers may be breastfeeding, but not exclusively, yet the child is less than 6 months. So you expect that person to be exclusively breastfeeding, but then they are introducing other feed. So the baby is not breastfeeding
because
as
some
much.
are given formulas in hospitals and everything.
And then some others say, I don't have enough breast milk, let me supplement with like formula, or let me give porridge. So that baby is not exclusively breastfeeding. That means your body is not protected against pregnancy. So you can...
What is the logic there? That when I exclusively breastfeed, I cannot conceive. When I stop exclusive breastfeeding, then I conceive.
You know, when you're exclusively breastfeeding, the hormones that are responsible for your breast production also inhibit you from ovulating to make sure that you get pregnant. So when you're breastfeeding very well, the mother is not likely to get pregnant. But when you stop breastfeeding, that hormone reduces in your body, so the ovaries start growing, they're released into the system, into the uterus, so you can easily get pregnant. So for mothers who are breastfeeding, and you feel that you're breastfeeding, but you're giving other forms of food, it's not 100% effective for you to breastfeed, to say that you're protected against pregnancy. Then there's mothers who use the moon beads or the calendar method. You know, our bodies are different, and then the menstrual cycle changes according to external factors. We also have external factors
like climate,
stress, nutrition. So sometimes you may think your cycle is consistent. Then there's that external factor that will make your cycle change. So sometimes it's also not very good for you to follow. And some people believe that when I follow my days, after my periods, I cannot get pregnant.
Yes.
So people relax and they're not protecting themselves, then they get pregnant. That's why we have a number of people who say, I accidentally got pregnant. Or someone tells you, but I was counting my days. I don't know what happened. This time, I got my periods on the 30th. Now it's on the 8th, I haven't yet seen my period. Because of external factors, your cycle has changed. So you can easily get pregnant when you use that form of family planning.
So it is not safe.
It's not safe. There's no method, I would say, apart from permanent methods. Most of them are not 100% effective. They're 90% effective in that range.
Okay.
Yes. So when we talk about the natural methods, we go to we also have the withdrawal method for the men.
Now, allow me ask you on that particular method. We have very many people who have been told that when you use that method, it affects your erectile functioning.
No, it doesn't. It doesn't affect because it's the normal system. The person withdraws at the point of ejaculation. That's when they withdraw and ejaculate outside the woman's body. So your erectile system is not affected at all. It's maybe people who do masturbation, but then for people who are using it as a form of family planning, it does not affect your erectile function. You remain the same.
So is this safe because there is no contact between the...
Like I said, no method is 100% safe. We have the pre-ejaculate, and then some people at that point of ejaculation cannot withdraw. So it requires discipline for both spouses. For the man to know that I'm about to ejaculate, I need to go off and ejaculate outside the lady. And then for the lady also to detect that my husband is about to ejaculate, I need to make sure he goes off. Otherwise, if they are not disciplined, they will end up conceiving on that particular form of family planning. So we've not been encouraging people to do that, to use it, because there's some failure rates. I wouldn't say so many, but there's some failure rates.
Yeah.
Then we go to our short-term methods. Yes, some people believe when I take the pills go into my body, they form a clump somewhere, and then
they accumulate, they don't go anywhere.
They don't go anywhere.
They keep in my body.
They'll keep in my body, and then they will do what? They'll cause cancer in my body. That is
or even fibroids.
When that pill is sugar-coated, the moment you swallow that pill, it melts into the system and is absorbed into the blood system. That's why when you're taking your pills consecutively, you do not conceive because it's going to the right places. It's distributed to the right place and it's excreted. You go and pass urine and it passes out of your body. It does not clump and stay somewhere in your body like some people think. And then some people think maybe you produce children who are deformed because of the pills. All those things are not correct because, like I said in one of the sessions that we had previously, genetics and hormones do not mix so much. So if you feel if you feel that the pill is going to make you give birth to a child without an arm, with missing eyes, with a nose missing, no, that is not true. We need to tell people that some of these things, yes, people do produce them, but if you check a background check on that person, they have not even been taking any form of family planning. So it's basically genetics that this person is having such issues.
And some also think that when I take pills, maybe I'll grow fat, you know?
Yeah, some
or
people,
maybe I'll have a lot of spots on my face.
Some people believe when they take pills, they grow fat in size. Others feel they will lose weight.
Yes. Like
I said, these pills have side effects. So sometimes when we are educating you, we tell you that you may gain weight or you may lose weight. During the counseling, sometimes these pills can make you feel as if you're pregnant. So when ladies are pregnant, they tend to react different. Some people will be craving and they're eating so much, so they tend to grow fat. Others don't eat, they have loss of appetite, they have that bitter taste in their mouth, so they're not eating, they tend to lose weight. So when you're taking these pills and you realize that they're making you grow really, really fat, you come back to the health facility and explain to your provider. She will be able to help you. If you're losing so much weight from the weight you took before taking the pills, when you go back for review and you notice there's a drastic drop in your weight, go back to the service provider. She'll be able to change the pills. And then some people believe when they take pills, they will not give birth again.
Yes.
Some people will tell, out there people are saying when you take pills, you become barren for life.
Yes.
I want to tell you, no, that is not correct. That is not correct. There is return of fertility the moment you stop taking the pills. But like I said, our bodies respond differently. There are those ones who will miss a pill today and then conceive the next week or conceive immediately. There are those ones who take a period of 6 months, others will take a period of 1 month before. So like I was saying that when someone is on a pill and they stop the pill, we expect that woman to resume her fertility after some time or immediately, depending on your body. So we usually tell you, give yourself time, because some of us are very fertile, some of us are not as fertile as the others. So you would expect someone to have conceived within the first 6 months of stopping the pill, but then she takes like a year. Give it time so that the body can readjust without the pill and be able to conceive.
Wow. This is Health Thought that you're watching. We are going shortly for a commercial break and we shall be right back.
Do you know that you can now enjoy great enriching shows anywhere through the Family TV app? Here is how to download it. Open Play Store on your phone. Search for the Family TV app. Click Install. After installing it, open it and enjoy enriching content anywhere, everywhere, anytime. Family TV, enriching lives.
The starting point of your surgery, when they say attention and you hold your legs, you have made yourself a soldier.
Then I said, now I know you want me to get saved, so I am going to get saved. But give me time. Can you imagine telling God, if you ask him for something, can you imagine him telling you, give me time?
I praise God that I was condemned. Because if I wasn't condemned by man, then consequently I would have been condemned by God. But because of that human condemnation, that led me to my salvation.
Brethren, yes we can. We can clear the debt of church house. And I want to invite you to give generously to the love gift. May God bless you as you give.
Welcome back from that short commercial break. This is Health Pod brought to you by Makerere University School of Public Health. Together with Church of Uganda Family TV, Edrine Osteen Mukalazi is my name. We are with Dr. Rashidah from Maristops, Uganda, taking us through the various misconceptions that people have on the various family planning methods. And before the break, we had reached other pills. So she had taken us through what we people think is true about the pills and what research has proved not true and what research has proved true about the pills. So doctor,
Yes.
Anything else about the pills before we can go to the other methods?
I want to tell people that when you take your pills well, there will be a good method, like taking them according to the instructions of the health worker. And when you stop the pills, we expect you to return to have your normal fertility. So don't worry and stop saying that you will not take the pills. Yes, the side effects are there, but they are manageable. And if you tell us, we shall help you.
So what is important is you identifying the side effect and then reporting it to your service provider.
That's if it happens, because like I said, our bodies are very different. Some people are normal when they take their pills, others have some minor side effects, others have moderate, others have severe side effects. Depending on the severity of your side effects, we shall manage and advise accordingly. So we shouldn't be worried to take the pills if they're given to us.
Okay.
Yeah, some people believe that the pills are going to cause cancer.
Yes.
No, like I said, the pills actually protect us against certain cancers in our body, like research has proved, ovarian cancer. So we should know that we are protected to a certain extent. Yes, so we shouldn't get worried.
So what about the other short-term methods?
The other short-term methods, I would say the injectable, the one they give every 3 months. So, of course, it also has its myths and misconceptions.
Yes.
Some people believe when they take the injectable, they grow fat, others lose weight, others feel that that medicine is going to accumulate in their bodies and then they will not be having their periods because, like we saw, the injectable, sometimes you go for months without having your regular period. So people believe that blood is collected somewhere in their bodies, in the uterus somewhere, waiting to burst out. And then some people tell you that started getting the injectable, the menstrual blood is dark, green, they have all kinds of stories about the injectable. But like I said, we are unwrapping the myths and misconceptions about certain methods. The injectable is given to you after 3 months. What it does, it makes your body not to release eggs on a monthly basis. It also makes your body to be able to pretend, okay, the body acts as if you're pregnant, so that you cannot be able to deliver again. So when that injectable is given to you, some women will not see their period because that lining that forms in the uterus to hold the baby is not formed. It makes that lining thin so that you don't get your period on a monthly basis. Some people, it becomes very thin that they don't get their period at all. Some people get their periods and they'll be normal. And then some people even bleed excessively. So you have to know, this is what I'm dealing with. I need to contact my health worker at this point to help me. The injection does not keep that blood, doesn't make that blood accumulate in your body. It doesn't accumulate anywhere. The only storage we have in our body is the uterus, where the baby grows. Anything that grows there it shouldn't be normal, but blood doesn't collect there. It just makes the lining of the uterus very thin so that you don't get your period, but blood is not accumulating anywhere.
What about those who say when they take the injectables, they experience the lower abdominal pain? Yes,
if you're experiencing severe lower abdominal pain, go back to your service provider. They will evaluate, they will check you, examine you, and find out to rule out sexually transmitted diseases or some infections so that they can give you some treatment. We have the PIDs, the pelvic inflammatory diseases that make your lower part hurt, your lower abdomen part hurt, or sometimes people complain with abnormal discharges. So go back to your health facility, go be examined, take off samples for the lab, and then they'll give you treatment. And then
maybe we also remind people that family planning methods do not prevent you from getting UTIs and STIs. So you take the family planning methods just to restrict your conceiving, but not you
The
acquiring the STIs.
Yes. And that's what I wanted to talk about. Some people believe when they are taking family planning, they are covered.
Yes.
They are covered against pregnancy and STIs, HIV and AIDS. No. Family planning, most of the methods of family planning just protect you from getting pregnant, but they do not protect you against STI. That's why we tell people dual protection. As in, when you're using this family planning method, always use a condom. Condom use is key because the STIs are going to be covered and the HIV. If you're not sure of your spouse, if you're not sure of yourself, use a condom on top of your family planning method. So people should not shy away from asking for condoms when they come for their health talks, because dual protection is what we usually preach. Then some people say when they take the injectable, they become dry, they lose out on sexual appetite. Some people say their husbands complain. So it all comes back to, for you to, we always advise women who experience that, take loads of fluids, so that you can help you rehydrate your body, which is very key. So we always encourage them to take plenty of fluids. If you're coming back, you're excessively bleeding on the method, it's not like it's going to drain you and you die. Because some people say, well, someone bled so much, got anemic and died. No one has ever lost their lives because of bleeding due to family planning. Just come back to your health facility or call our hotline or go to any center where you feel family planning is offered, and you'll be able to be helped.
Okay. I think we can now talk about the long-term.
Yes.
Yeah.
Or the long-term methods.
And very many misconceptions on the IUDs.
Yes.
Yeah, the intrauterine device. People think when it is inserted, it moves to the blood, to the heart.
So, like you said, we have the long-term methods. We have the pills, so we have the implants, and the IUD. The IUD, most people have so many stories about the IUD.
Yes.
First of all, the myth comes from the way it's inserted. There's a time where I stayed in a taxi.
And even the way it looks like.
I had someone telling her friend was stayed, like, they take out your uterus and then they put it there, then they put back the uterus. And in my head, I was like, this is a taxi, I cannot correct this. But I kept on, I eventually told her, you know what, if you need correct information, I think you need to go visit a health worker to take you through how the IUD is inserted. People, no one takes out the uterus inside the IUD. No one. It's inserted in the most clean way, as long as someone has been trained to do it correctly. And it's a very short procedure. It's painless. It's supposed to be pain-free. Though we give you some painkillers, it's supposed to be pain-free.
Before the process?
Before we give you because some people experience some bit of cramping after, so we want to give you some bit of painkiller. But the IUD is inserted where we don't take out people's uteri to make sure we insert the IUD. And then some people think when the IUD is inserted, it will disappear.
Yes.
It will go to the heart. Our bodies naturally are compartmented. They have compartments. We have the upper part where the lungs, the heart, there's a diaphragm, there's a layer there that separates.
Yes.
Then we also have the lower part where the intestines and the guts are. And then we have the uterus, down the ovaries, that is the female body. So when we are inserting the IUD, we insert it in the uterus, through the cervix. We don't even see inside your uterus. We stop at the cervical os. So it's inserted very well. The way to, I always tell people, have you ever vomited out a baby? No. Have you ever seen someone who says, me, when they wanted to bring out the baby, they cut me up here in the throat to get out the baby? No. So the way we inserted the method is the way we are going to take it out. If we've inserted it through the vagina to the uterus, that's the way we are going to remove that method. It does not move anywhere. It's always in there, in the uterus. It's always in there. So people that admit that to go to the heart, it can't move to the heart. It stays in the uterus.
What about those who complain that it gives them sexual discomfort?
Yeah, most times, especially the women will come back and tell us, my spouse is complaining, the strings are pricking me, the IUD is pricking my man's thing. And our ladies love their spouses so much. Anything that affects the women's happiness, they will come back, the man's happiness, they will come back and complain. So when someone comes back and tells us such a thing, we don't take it lightly. We examine. Sometimes you'll find that the IUD has detached. It has detached from the fundus of the uterus, and it's actually peeping through the cervix. So it's actually pricking the spouse or pricking the person. So with the penis, so we usually remove and reinsert. Sometimes the strings were not well put, and then they were like pointing. So we make them lie onto the mouth of the cervix, so the person does not complain or does not have any issues. So every time someone comes up with such a complaint, we usually do examine them and find out how true their complaint is and help them. Sometimes some men will come and say, this thing is pricking me, I want it out. But when you go to check, the thing is beautifully placed. Like everything is in place. So you just counsel him. If he's understanding, you counsel him to understand that this method is well put and it will not affect you. Some people think that the woman when they're having sexual intercourse, the man will push the IUD, and it comes to the gut, to the intestines. So we usually tell people, even when a woman is pregnant for 9 months, she can carry that baby without the man ever touching the baby's head or anything. Because we've not had stories of people telling us that, when I was pregnant, my husband used to feel the baby's head. So we tell them if that process can take place, even the IUD can be there without your man pushing it from the uterus to the intestines, like they usually say. Yes, so that is our IUD. Wow. It has so many stories, but that's the best we can say, that the IUD does not move anywhere. It will stay in the uterus. And time for removal, we shall remove it the same way we put it. Other people say, of course, there are those women who conceive on it, but that is 1 in 1,000, because we said the IUD is 99.9% effective. So when it happens, we usually advise you, don't panic to come. If you want your pregnancy, don't panic to come and remove or don't pull out that IUD. Go to a health worker and they will examine you and even counsel you. Because the moment you tamper with that IUD, you're likely to lose the pregnancy. And yet you can carry that pregnancy to term with an IUD. It will not come back with the baby touching it. Some people say, I hear someone delivered with the IUD and the baby had the IUD in their hands. These are stories. It's outside the amniotic sac where the baby grows from. It's outside because the baby comes, God made it very, like science or whatever, God made it. That baby grows in a particular environment. So that baby will stay in there. That IUD will be out of the sac. You deliver your baby. At the point of delivering the placenta, the IUD will also come out. So, but
differently, not with the baby.
It will not come out with the baby. So at most times when the water breaks, it also comes out. Because it's outside, that pressure gushes it. But most of the time it's after the baby has been delivered. As you're delivering the placenta, the other parts of the uterus, the uterus that were in there, the uterus and everything, it comes out. So I would advise women to go to the health worker, talk to her. She'll talk to you, especially midwives are very knowledgeable about this. Then she'll advise you.
Well, maybe because of time, Doctor, we are going to encourage people that if you have any questions on the family planning methods that we've not talked about, please don't listen to unprofessional people. Just go to a health facility. They'll answer all your questions. Doctor, maybe as we wind up, remind us the facilities where people can find these services, where people are trained to really handle and answer these questions.
What I have to tell the community out there, that most of the midwives in these government facilities have been trained. And like I told you in Marriage Soaps, we have a channel that has gone an extra mile to train these midwives. The private sector, the public sector strengthening channel is called PSS. It goes to government facilities. It further trains the midwives on how to deal with family planning. So go to government facilities, the services are there. We have outreaches that come every month to government facilities. Find out in your area and go visit them. Those are free of charge. We have Blue Star facilities in all areas of the country, by the way. They are there. We have 15 centers. The outreaches are 29 all over Uganda. So in every part of Uganda, be it eastern, northern, western, you'll find an outreach of marriage stops. We have 15 centers all over Uganda. Walk into the center, tell them, they'll help you. Center, and we also have a hospital, Marriage Stops Hospital here in Lugogo. They can also help you at a fee. It's not free of charge at the hospital and the centers. You pay a fee. We also have another channel of the MS ladies, Marriage Stops ladies. Those are people who also have been trained to handle family planning issues. When you go there, they'll help you. If you have any issue and you need to talk to us, we also have the hotline center, the hotline number. Be on call full time. You can call them. They talk to you and advise you where to get home services. But just know wherever you go, you'll get services.
Wow. Thank you so much, Dr. Rashidah. And we are so grateful. Thank you so much for taking us through all these sessions of family planning. And I've worked with Mabel Murungi, the sign language interpreter, Jonah Jal, the producer, Edrine Osteen Mukalazi is my name. God bless you until we meet again next Friday.